At this point, I don't even know who is more stubborn between ulcer patients and lactose intolerant people. But that's a discussion for another day. Today, my business is to tell you 10 reasons why your ulcer may not be healing. But before I do that, please subscribe, turn on the notification button so that you can be aware when these videos are coming out. Now, ulcers should typically heal over a few months of treatment. But Nkechi and Amaka, is only the two of you that your recurring ulcers have been there since you were teenagers. This prolonged issue can be a result of 10 things. Number 1, a H. pylori infection. See, many stomach ulcers are caused by bacteria known as H. pylori. This bacteria gets into your stomach and then starts to burrow a hole, so a place where the acid cannot get to it, and then the acid follows that bacteria and then starts to injure the inside of your stomach. This acid now follows it, leading to ulcers. This bacteria is also very common, but it only causes ulcers in about 10 to 15% of cases. Now, it's hard to completely get rid of, and it can come back, especially in places with poor sanitation. It can also become resistant to medicine. So if your ulcer is not healing, Nkechi and Amaka, check what you're eating or who you're kissing. H. pylori can also be spread through mouth-to-mouth contact, dirty food, dirty water, and poor hygiene. Number 2, continued use of non-steroidal anti-inflammatory drugs known as NSAIDs. See, they are used to reduce pain, reduce inflammation, reduce fever, and sometimes your doctors may prescribe them for these reasons. However, you also need to understand that it can aggravate ulcers. And if you have an ulcer and you take an NSAID, it could probably make you worse. It's probably what even caused your ulcer in the first place. So, my dear, you need to understand that when you have pain and you have an ulcer, you need to talk to your doctor for alternate medication that can help that pain. Number 3, smoking. See, Mecca and Pius, you have ulcer, but every weekend you people are doing we're outside. There's shisha in the club, you are there. There's cigarettes, you are there. There's weed, you are there. Using your money to buy what is destroying your stomach. Hear me now. Smoking can hinder blood flow to your stomach lining and slow down or even completely stop your stomach ulcer from healing. And if you've been battling a stomach ulcer for some time, you need to do a little reflection and make some lifestyle changes. Ensure that you're not part of the chimney gang. Yes, there's no exhaust at the back of your head because your name is not Emeka Downfall. Number 4, alcohol consumption. Excessive alcohol intake can irritate and inflame the stomach lining. This condition is known as gastritis, which can cause peptic ulcers that even prevent existing ones from healing. So, if you have ulcers, please reduce your alcohol intake. As for me, no amount is safe, according to the WHO also. So, whether it's not my own is whiskey, vodka, there's nothing like that. If you have ulcers, avoid alcohol. Number 5, stress. I know we cannot avoid stress, but chronic stress can impact your body's healing process. And the same even goes for your ulcer, because stress can also increase acid production in your stomach. And when you combine it with an ulcer, it probably won't heal, because imagine there's a wound on the outside of your body and I keep pouring acid on it. You know it's not going to heal. So my dear, try as much as you can to reduce your stress levels. Number 6, inadequate treatment. When you went to the doctor to talk about your ulcer, they gave you antibiotics for 14 days. After day 7, you stopped because you're no longer feeling the pain, because you have bad character also. Now, you also need to understand that this is not rocket science. Completing the course of your medication, especially your antibiotics, is equal to your ulcer healing. Even worse, when you stop it halfway, your body can become resistant to those drugs. So when you're taking it the other time, it probably won't work. Remember that we talked about H. pylori as the bacteria being very stubborn. So you can see right now that completing your medication can be the biggest thing for yourself. If you are having side effects from the medication that your doctor has prescribed to you, don't just stop. Carry the medication I'm going to give the doctor and tell him that these are the side effects that you're having. And another batch will probably be prescribed to you to attack those side effects. Number 7, dietary factors. When they give it to some of you, they put you and pepper in the same group. And that's why you and ulcer cannot heal. Because you also need to understand that spicy foods can increase the acid in your stomach and then even affect the rate at which your ulcer is healing. Things like soda, things like spicy food, things like coffee should be avoided or reduced. As a matter of fact, anything that does fishy, if you have ulcer, please don't take it. I want you to treat this thing like there's a wound outside in your body, just that it's in a place where you can't see it. If you can't do that to what's outside, don't do it to what's inside. Number 8, medical conditions. The one I'll focus on is one known as Zollinger-Ellison syndrome. It's a rare condition in which there's a tumor in the, that can develop in the pancreas or the small intestine, and these tumors produce a lot of hormone called gastrin, which can now make the stomach produce too much acid. This high acid level can cause various stomach problems, especially peptic ulcers, and can also stop the healing of already existing ulcers because it makes them stubborn and resistant to treatment. So if you notice that your ulcer is not going away, despite everything that you've tried from all these things we've been saying till now, it might be time to get your doctor to look inside your intestines. Other conditions can also affect it. Malnutrition, anemia, diabetes, cardiovascular diseases, even sickle cell anemia may also cause your ulcer to heal more slowly because of the reduced blood flow to the stomach lining. Number 9, the size of the severity of the ulcer. See, for some of you, it's until you collapse. That's when you will visit the hospital to check yourself. You will have ulcer symptoms for years, even months, but you refuse to see a doctor simply because, for many reasons. So I'm not here to judge. But at the same time, you need to understand that as soon as you start to feel the pain, it's time to go to a hospital. If you leave it, I've seen cases where it can bore a hole through the stomach from the other side into a blood vessel, and that person might start vomiting blood or passing blood in their stool. And at that point, there's really not much that can be done. And last but not the least, age. See, as you get older, several factors can prevent your stomach ulcer from healing quickly. The natural aging process, first of all, means that the amount of cells your body can regenerate and repair becomes slower, meaning that your stomach lining might take longer to heal. Secondly, older adults often have reduced blood flow and circulation due to reduced movements, lack of activity, lack of exercise, and is limiting the delivery of essential nutrients and oxygen to the place where it's needed. Another thing you also need to understand is that your immune system weakens as you get older, making it hard for your body to fight off infections that can now help complicate these ulcers. So, older people might be prone to some of the diseases that I mentioned earlier, and this might generally affect the time it takes for their stomach ulcers to heal. If you've learned anything, check yourself and see if there's anything in this list that you're doing. If you are, please go back to your doctor and tell them that you've repented, and don't forget to subscribe, like, comment this video. And if you think there's anything I missed out, please put it in the comment section, and I'll see you in the next one.